Hey, what's up, guys? My name is John, and I'm an emergency medicine physician assistant. Welcome to my channel. In today's video, we are talking about new grad PAs and NPs. Should they be getting into urgent care or the emergency department? You see, there's a lot of information on the internet essentially saying that new grads should just absolutely positively avoid these two specialties whatsoever. As with everything in life, there's a little bit of a nuance. I started off in the emergency department and I've been working in the ER since 2019. And I know plenty of friends who have also graduated from my PA class who are working in urgent care right now, and they started in urgent care and they continue to work in urgent care. What is super important for new grads is what sort of training are you getting? What sort of oversight are you getting? And what sort of services or specialties are offered at your location? People think urgent care is a cakewalk because, oh, it's lower acuity, things are easier, etc. And while you can run through a lot of patients at urgent care because half of them will have sniffles, there are also lots of emergencies that come in through urgent care. If you are unable to identify which patients are sick, which ones need to go to the hospital, which ones need more of a workup, and they're just in the wrong place at urgent care, then you will have a bad time in urgent care. Likewise, urgent care is very procedure heavy. So if you're not confident in doing INDs or suturing or confident in reading x-rays, sometimes some urgent care facilities won't be giving you that sort of support that you need. So when you're applying for your urgent care, what's super duper important is making sure, one, you know what is the daily volume at your urgent care. How many patients are you as a provider expected to see in a day? And how many patients an hour does that come out to? Hey, you're expected to see 50 people in the span of 8 hours. That is a no-go. That is a runaway from urgent care sort of scenario. Another very important factor with urgent care is, are you a solo provider or do you have backup? And if you do have backup, when do you have backup? Because sometimes there might not be two providers all day. They might have two providers for a portion of the day. Every location is different, but I think with urgent care, if you are a new grad, you should be looking for, even if it's a little bit busier, you should look for maybe an urgent care that has two providers on at all times. And that way, you know that at least you will always have somebody else there that you could bounce a question off of or talk a case through with. And hopefully you guys aren't super duper busy at all times of the day. That might be a better route for just starting out. Another very important thing to ask about, and I'll also talk about this in the ER section, is how long is your training period? If the training period is the span of, hey, there is no training period, that's a bad sign for urgent care or ER. If they say, yeah, we'll give you like 2 weeks, that's also a bad sign. You should be talking in terms of months, right? Some sort of oversight, some sort of supervision, some sort of somebody actually reviewing your charts, actually talking about cases with you, having a plan. I think all of these things are very important when you are just starting out in these sorts of locations. If their goal is for you to just hit the ground running and start seeing patients, you might have a harder time getting acclimated to urgent care or the ER. I personally believe that the ER, getting started in the emergency department, might be easier than urgent care because even though the acuity might be higher, you may have different expectations. As a new grad, you're not working solo coverage in an emergency department. You have doctors, you have residents, and you have other providers to help you so you can ask questions and you can get answers. People might be busy with something, but there is oversight. I feel like I thrived in the ER because I had a good foundation. My medical director sat me down and said, John, at 6 months, we want you to be able to do XYZ. At 12 months, we want you to be able to do all of these things. We want you to go to a boot camp or some sort of course, talk through any cases with the doctors. I want the doctors to see any level 2s or 3s with you. John is new. You have to go into the room. You have to at least say hi to the patients. You have to maybe, ask questions and be involved. Obviously, some doctors were more willing to help out than others, but every single one of them acknowledged, hey, it's a new grad PA. I should be invested in his cases. I should be looking at the lab work with him. I should be talking through some stuff with him. The first time seeing certain cases or presentations, everything is novel, but then you write it down, you start doing a little bit of research on cases after your job, and things start to stick. Things aren't going to start sticking until you are a couple months in. It's just the nature of the game. You're not expected to walk in there and know everything about everything. And even to this day, I'm 4 years in, guys. I'm very good at what I do, but I'm not going to sit here and say that I'm perfect, don't make mistakes, and that I've seen everything, because that's impossible. The first 6 to 12 months is really a determining factor on how well you do. Fact, I'm rambling at this point, but the most important fact is finding a place that is supportive, that has a good set of training, that has a good plan for you as a new grad. If that facility doesn't have good training, if they're talking to you in the span of you will be up and running in the next 2 weeks, that is a bad sign. Working in an emergency department is not sink or swim. So you need to find a spot that is supportive and will train you, even if they won't pay you as well. You take that job for the first year or two and you learn what you can, and then you could always move on and find other pastures, greener pastures that will pay you more money. One advantage that you have in the emergency department or urgent care, obviously, is experience matters a lot. It's kind of hard to find a PA that's been doing the working in the ER for 5 years, 10 years, 20 years. So the better of a foundation you get and the more experience and years you have under your belt, the more marketable you are, and the more success you will have in the emergency department in urgent care. To summarize, you guys want to find a job that has support on staff, that has a good attitude about your training, that has oversight, doctors, and a group that are friendly and willing to help teach you. You do not want to find yourself sitting in a cube or box by yourself trying to figure out everything on your own, or trying to do some cursory last-minute research to figure out how best to manage a patient. You can get started in the ER as a new grad. You just need a support system. Thank you guys so much for watching, for subscribing, for leaving a comment, for following the channel. It means a lot to me. Best of luck on your endeavors. If you're new in the ER, if you're new in urgent care, as always, stay safe out there. Have a great rest of your day. Bye-bye.